Arthritis joint pain could be reduced by eating a handful of cherries a day. Cherries could reduce joint pain in both osteoarthritis and gout patients. Scientists have claimed the fruit contains anthocyanins, plant pigments that have powerful antioxidant and anti-inflammatory properties. According to the Arthritis Foundation, anthocyanins are found in red and purple fruits, including raspberries and blueberries, but they're especially rich in tart cherries. Eating at least 10 cherries a day provided enough anti-inflammatories to reduce joint pain in gout patients. Researchers are reluctant to recommend a specific cherry diet for arthritis patients until more evidence is gathered, said the Arthritis Foundation, but they agreed it could be a possible tool in managing gout and osteoarthritis pain. It added, 10 million people affected by arthritis in UK. Symptoms of the condition include joint pain, inflammation, restricted movement, muscle wasting, and red skin over the affected joints. There is currently no cure for the condition, but some treatments could help to slow down its progress.